Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. When we come back, we will be discussing how your smile can make you feel more confident and help your self-esteem with Annapolis, Maryland's leading cosmetic dentist, Dr. Djawden. Dr. Djawden is one of only about 4% of all dentists in the United States that has the advanced training, experience, and facility to be able to personally handle every step of a patient's dental goals. He is also a graduate of Tufts University and a member of the American Academy of Cosmetic Dentistry. Welcome back to A New Me. We are here with Annapolis, Maryland's top cosmetic dentist, Dr. Djawden. Welcome, Dr. Djawden.
Thank you, Rocco. How are you?
Oh, fine, thanks. It's our pleasure to have you with us today.
Pleasure to be here.
Let me begin by asking you if you can please tell us the significance of a smile and how it may affect our lives and relationships.
Absolutely. It's interesting because patients actually tell me how a good smile and or their smile affects their life, in that I've had people tell me that they've stopped a relationship because the person who they are going out with, they didn't like their smile. And or we have patients who come see us to improve their smile because they personally know that they don't smile as well, so they think that others perceive them as being grumpy. We have men who actually grow out their mustaches to cover up their smile or a lack of adequate smile, if you will, and others who smile in a crooked manner to hide their teeth. So from a self-confidence standpoint, it has a huge effect on patients and people, and from a work standpoint and being able to progress in the field that they are, it definitely makes a significant difference.
So based on what you just told us, it can certainly affect one's not only self-confidence but self-esteem as well.
Absolutely, absolutely.
Now, what are some of the more common problems that may affect our smile?
The most common things that affect smiles, obviously dental decay could be one. Teeth that are discolored, chipped, cracked, rotated in a manner that is not pleasing. So all of those can be factors.
And what's the process as far as identifying what problems someone may have with their smile? What would it entail, Dr. Djawden?
You know, in our office, Rocco, what we do is it's very important for me to get a great understanding of why the patient is seeking the treatment. Because understanding the reasoning for the patient wanting to improve their smile is a key with respect to what we need to do for the person's smile. So we take a good hour discussing that with the patient, finding out you know, what they're concerned about, what they've done about it in the past, if anything, and how that's worked for them, whether it has or it hasn't. All of those informations are key to then coming up with the proper treatment plan and or plan of attack to correcting a problem that the patient might be concerned about.
So basically you do a needs analysis and find out what might be available as far as what's the correct treatment option for each individual potential patient.
Yeah, we call it a want analysis because it's more what the patient wants us to do and or to look at. Now, if there are other things that will affect the overall treatment, we will inform the patient about it. But it's more important to know what is it that the patient wants. Is it realistic and is it doable? And in majority of cases, it is. And our basically position would be to understand that and be able to deliver that for the patient.
And what treatment options are available to correct these problems that you described?
The treatment options that we have with I mean, it's amazing with the advancements in dentistry and advancements of technology in dentistry. It can be as simple as a 1-hour bleaching of the teeth with our Zoom 2 system, where teeth will basically be as white as they're going to get after that 1-hour time frame, to more complex and or complicated situations with respect to restoring and or correcting chips, cracks, severe discoloration of teeth with veneers, dental veneers, and or either porcelain veneers and or porcelain crowns.
And I'm sure the results can be very extreme depending on the work and the treatment option.
You know, the results can be tremendous if the communication between the patient, the doctor, and the ceramist are all on the same page, because it's important to dictate that to the ceramist so they can provide us with what exactly are we looking for.
I believe you have some patient before and after pictures you'd like to show us, Dr. Djawden?
Absolutely, yes.
Let's take a look.
Sure. Here in our first patient, we had a gentleman who came in, and he was recently retired and was going to start a new business. And he didn't like the way that the tooth there had that dark rim around it and the misalignment of the teeth in the before shot. So we went and basically through dental veneers and several porcelain crowns redid his smile, where you can see he's got much better color around the gum line on that previously crowned tooth. We've corrected some of the major